is Jessica Humphrey, and this is my persuasive speech on antibiotic resistance bacteria. Due to the speed at which diseases spread during World War II, antibiotics rose in popularity at alarming rates. The Surgeon General proclaimed in 1969 that infectious diseases were a part of the past. He may, however, spoke a bit too soon. Antibiotics are now commonly given to cattle and poultry in our world. Scientists and medical doctors are now in a race against time to overcome antibiotic-resistant bacteria. Economists say that if this bacteria continues to grow at the strength it is now, it could cost the world up to $100 trillion by 2050. Through the excessive use of antibiotics, resistant bacteria is now threatening the life of animals and humans around us. To begin, it is important to understand what antibiotic-resistant bacteria is and why it is working against us. Antibiotic-resistant bacteria occurs in the body when bacteria can overcome the powers of an antibiotic drug. This lowers the effectiveness of the antibiotic and could change modern medicine for what we know it today. First of all, like I said in my introduction, many antibiotics in this country are given to livestock to make them bigger, whereas they used to be solely used for medical treatment. In my work, I commonly come across livestock and farmers. They are constantly competing for the largest and the strongest animal, so antibiotics are commonly used. The opposing side states that antibiotics help the animals grow better. But in 2016, the World Health Organization states that drugs make the livestock grow faster and healthier in densely packed areas, but they fear that if antibiotic-resistant bacteria continues, we may lose large amounts of our food supplies. The Center for Disease Control and Prevention states that when antibiotics are used in meat and poultry production, the antibiotic-resistant bacteria is often transferred into the food that we eat. If the overuse continues, there will likely be more hospitalizations for humans, which will rise medical costs. Dr. David Haslam, who is a pediatric specialist at Cincinnati Children's Hospital, states that this will affect some people in particular more than others. Some examples of these people are children undergoing chemotherapy and cancer treatment, those undergoing transplants, and those in the hospital for severe trauma reasons. When forming your own opinion on this topic, it's important to take both sides of the story. First of all, if antibiotic resistance continues to grow and is ignored, our future may be at stake. Some say bacteria is normal in the body, which is true, but when you get bad bacteria and antibiotics no longer work against that, that's when lives become at stake. With my interest in pharmacy, I wanted to learn more about how antibiotic-resistant bacteria works between animals and humans. In 2017, the CDC states that tuberculosis, malaria, and ear infections are now much more harder to treat than they were just a few decades ago because of this resistant bacteria. In 2015, CBS News reported that 2 million people get sick with antibiotic-resistant infections every year. There are several things we can do, however, to slow down and help reverse what has happened in antibiotic-resistant bacteria. I'm going to share a story where this has happened and what scientists did to help turn it around. Stuart Levy, who is a microbiologist at Tufts University, came across a chicken farm where the chickens were given oxytetracycline, which is an antibiotic given to animals to stop the spread of bacteria in the body. They had been given the chickens oxytetracycline for about 6 months when the testing began. They found antibiotic-resistant bacteria in the intestinal flora of the chickens. Also, just to be safe, they tested the farmers who worked on the farm, and they found that same resistant bacteria in their intestines as well. Stuart Levy took away the antibiotics from the chickens and retested them 6 months later. And after this 6-month time period, most of the resistant bacteria had disappeared from the intestines of the farmers. Even though problems exist, there are many solutions to slow the resistance to antibiotics. In 2014, the Center for Disease Control and Prevention stated that there are 266 million antibiotics prescribed every year, and at least 30% of these are unnecessary. So the first thing we can do to slow antibiotic resistance is to only dispense what antibiotics are needed. Also, follow good safety and hygiene practices when you are coming in contact with animals and livestock that have been given antibiotics. This can be done when handling raw or undercooked food. Be sure to wash your hands and wear gloves if possible. If you are given antibiotics for medicinal reasons, you should follow several guidelines given by the CDC. Two that I think are most important are using the full course of the drug and do not save the antibiotic. First of all, you should take the full course of the drug because even if you start to feel healthy again, there is likely bacteria remaining inside of your body. And if you stop taking that antibiotic, the bacteria will become resistant to it, and that is how antibiotic resistance bacteria started. You should also not save your antibiotics because most likely the next time you become sick, it will be a different strain of flu or bacterial infection, and you'll need to go to the doctor and get a different prescription. Clearly, it has been shown that the excessive use of antibiotics can cause harm both to animals and humans. Some groups, however, are trying to combat this. For example, in 2016, the United Nations came together and pledged to fight antibiotic resistance in a General Assembly meeting. Additionally, the FDA is advocating for public awareness by making more websites and brochures that will influence people and give them the information they need to know about antibiotic resistance bacteria and different infections and how they can keep themselves healthy. Additionally, the FDA is promoting clinical studies to create new antibiotics that will work against these resistant strains. With your help supporting farmers who do not use antibiotics in their animals, knowing when and when not to take antibiotics, and supporting the United Nations and the FDA, we will be able to help eradicate the superbug of antibiotic resistance. Thank you.